Hello, everyone. Welcome to another assessment for our CAA students. We shall be reviewing heart pathology, first aid, and general physiology. Okay, so let's do this in unison. Let's go to heart pathology. The hardening of fatty plaques lining the blood vessels is called
Atherosclerosis.
which of the following causes crushing, vice-like pain in the chest?
Angina.
Yes.
China.
Coronary artery disease is also known as
Ischemic heart
Ischemic
disease.
heart disease.
primary hypertension can be caused by
High salt intake.
yeah, actually they don't know the cause pero they notice na yung mataas yung salt intake. Which of the following is the correct medical term for heart attack caused by blockage in a coronary artery?
Myocardial infarction.
For us, we will call it MI para medyo mataas ang level. Diba? Heartbeat that is above 100 beats per minute in adults is called
Tachycardia.
okay. Abnormal rate and rhythm of the heart is called
Tachycardia.
no
Arrhythmia.
arrhythmia. Atrial fibrillation is an abnormal heart rhythm characterized by
Rapid and irregular beating.
okay. Para medyo social,
Rapid and irregular
atrial fib, ha? Rapid, irregular. Yeah. What makes heart failure acute?
It happens suddenly.
It happens suddenly.
Yes. Hypotension is the medical name for
Low blood pressure.
Low blood pressure.
extreme vasoconstriction of peripheral blood vessels when exposed to cold is a symptom of
Renal disease.
yes. Which of the following is a potentially life-threatening complication of DVT caused by detachment of a clot that travels to the lungs?
Pulmonary embolism.
Yes. A decrease in the amount of RBCs or hemoglobin in the blood is called
Anemia.
what is the name of the disorder which impairs body's ability to control blood clotting?
Hemophilia.
Okay, kumusta pasyente mo, Madam N? Share mo naman. Okay. Meron siya hemophilia.
Ay nako, may ano siya, may heat in the stomach, utot ng utot. Natulto kabaho. Hit kasi grabe. Tapos burp ng burp.
Okay.
Yun.
Leukemia results in high numbers of abnormal.
White blood cells.
What is a thrombus?
Blood clot.
When the
Blood clot.
leaflets of the valves in a vein, example in the leg, no longer meet properly, allowing blood to flow backwards, the vein is referred to as
Varicose.
yes. Leukemia is a group of cancers that usually begin in the
Bone marrow.
Bone marrow.
cardiac arrhythmias are due to problems with
Heart electrical conduction system.
mas nakakatuwa itong ganito na mas lively, mas madaling matapos, no? Thrombocytopenia is a blood disorder in which there is thrombocyte. That's platelet. Penia.
Decrease of thrombocytes.
Okay. Decrease. Okay. A heartbeat that is below 60 beats per minute is called
Bradycardia.
a decrease in red blood cell production can lead to
Anemia.
blockage in blood flow is called
Infraction.
above which of the following blood pressure readings would most adults be considered to have high blood pressure?
140 over 90.
Angina is caused by
Reduced blood flow to the heart.
which of the following is a common cause of high blood pressure?
Atherosclerosis.
Hypotension is considered as a diagnosis if the systolic blood pressure is less than
90.
90.
Less than 90. Which of the following is a normal resting heart rate for most adults.
60 to 100.
What is the medical term for the small dilated blood vessels, commonly known as spider veins, which can sometimes be seen near the surface of the skin on the face, leg, or at the ankle?
Telangiectasis.
Yes. Isa.
Ganito,
Telangiectasias.
telangiectasias. Telangiectasias.
Telangiectasis.
No,
Telangiectasis.
telangiectasias.
Telangiectasis.
Telangiectasis. Ectasia. Okay.
Telangiectasias.
One common definition of thrombocytopenia that requires emergency treatment is a platelet count below
50,000 per
50,000
liter.
microliter.
Okay. Now let's go to circulatory first aid. Malay nyo, di ba? What is the most common cause of shock?
Severe
Blood loss.
blood loss.
What effect would 0.5 liter or 1 pint of blood loss have?
Very little effect.
Very little effect.
When someone initially goes into shock, their pulse quickens, they look pale, and they have
Clammy skin.
Clammy skin.
What would happen if shock worsened and went untreated?
Heart would
And
stop.
heart would stop.
Di ba panic na? Why would you raise the legs of a casualty suffering from shock?
To improve blood flow to
Or
vital
to
organs.
vital organs.
Vomiting red or brown red blood may be caused by bleeding in
The
Digestive.
digestive system.
a leakage of fluid from around the brain may be recognized by thin watery blood coming out of the
Ears.
O sige, tignan
Ears.
niyo yung tenga niyo. Joke.
Ears.
The symptoms of angina pectoris are anxiety, shortness of breath, and
Five
Five
light
light
in the
pain.
chest.
sino
Pain in the chest.
nakaramdam na niyan? Sir Jobel, naramdaman mo na yan?
Mayroon na po.
Naramdaman mo
Ako
na?
recent lang.
Oh, okay.
Oh, no.
Nararamdam.
Ako
Bakit
recent
ba?
lang. Yan, sir.
The vice-like pain in the middle of the chest, characteristic of angina pectoris, can spread to...
The jaw and
Jaw and both arms.
Okay. So,
Both arms.
yung magkakaroon yan, you should be aware na, ha?
Lalo na sa left arm.
Yeah, pumupunta sa left. Ano, minsan both. Angina pectoris is when coronary arteries are
Narrowing.
Narrowing.
A heart attack is most commonly caused by
black
A
Blocked
black
or
coronary
coronary arteries.
when blood flow to the brain is temporarily reduced. It may cause a person to
pain.
someone suffering a heart attack will have a vice-like pain in the middle of the chest, but unlike angina pectoris, the pain will
not ease with
Not
rest.
ease with rest.
yes. So, anong gusto niyo? Ay, wala, no? As shock develops, oxygen levels to the brain lower, how will a casualty behave? They will become
Restless and
Restless and aggressive.
when a person suffers from shock, it is important not to let them
eat, drink, and
or
smoke.
smoke.
when a casualty has lost 2 liters or 3.5 pints of blood or more, it becomes difficult to
Detect a
Detect
pulse
a pulse
at
at risk.
so anong gagawin mo? 911. Okay.
Main one.
A severe allergic reaction that affects the whole body is called
analytic shock.
anaphylactic
Anaphylactic
shock.
shock.
The priority for the first aider helping someone who is suffering an anaphylactic shock is to minimize shock and
Ease
Breathing.
breathing.
a person suffering from an anaphylactic shock will have a widespread skin eruption, puffy eyes, and
Impaired breathing.
Impaired
Breathing.
if the pain caused by an assumed angina pectoris persists or returns, the casualty may be suffering from.
An heart
Heart
attack.
If a heart attack casualty is conscious, what can they be given to chew slowly?
An aspirin.
Aspirin.
Okay. Air hunger, often a symptom of heart attack, is what?
An
An
extreme
extreme
gasping of air.
gasping for air.
The body position that will put little stress on the heart of a heart attack casualty is.
Sitting on the
Sitting
floor
on the floor in
needs
its bend.
vents.
Mhm. Okay. You would help someone with their auto-injector of epinephrine if they are suffering from.
Anaphylactic shock.
Anaphylactic.
Aspirin can help dissolve a blood clot and thus.
Limit the damage to the heart.
Damage to the heart.
Shock may be caused by severe blood loss or by
Severe body
Severe
fluids
body
loss.
fluid.
someone with ashen skin and blueness at the lips is likely to be suffering from
Heart
Heart
attack.
attack.
heart attack. A person having an anaphylactic shock may run the risk of developing.
Hypoxia.
Yeah. Why would someone suffering from an anaphylactic shock suffer from hypoxia?
They have swollen tongue and throat.
Shock can be caused by a variety of reasons. Which of the following does not cause shock?
Psoriasis.
Right. Now let's go to general first aid. What is the first thing a first aider must do when dealing with an emergency?
Assess the risk.
Assess the risk.
Hindi ba pwede selfie? Joke.
Hindi pwede.
Joke lang. Assess the risk.
Tapos na.
Yung post. Why should you assess the risk first?
To avoid becoming
Find the quickest. To avoid. Hindi. It's to see if we
first
can help.
To avoid becoming a casualty. Diba?
Okay.
Kasi yun ang importante, pasyente mo. Diba? Once you have assessed the risk and made sure you can approach the injured person safely, you must then
Protect
Protect
casualty
casualty from possible dangers.
Once the area has been made safe, you can assess the injured person. At this point, it's a good idea, if possible, to
get help from others.
sisigaw ka na.
Get help from others.
Bystanders can help you control bleeding on an injured person, control traffic and onlookers, and most importantly, they can
Contact the victim's family.
help. Yeah. When calling the emergency services, you need to provide your phone number, information regarding the type of emergency, the number of casualties, and
Your location.
Personal address.
if a casualty is unconscious and not responding to gentle shaking, you will need to first check that
They are
They
breathing.
are breathing.
if the casualty is not breathing and you are alone dealing with the emergency, you will first need to
Call the
Call
emergency
emergency
services.
services.
no. Call ka na
Call the
emergency.
Call the
emergency
emergency services.
Malay mo, busy yung line.
Pag busy, CPR na lang.
Have you experienced this, Madam M, in your life?
Hindi pa naman po at wag po sana.
Okay. If an injured person is not breathing and you have already called the emergency services, tinawagan mo na ha, you now need to open the airways. Basta
Start chest compression.
Okay. So before ka mag-CPR, natawagan mo na yung emergency. Ha? At least parating na yung tulong. How many chest compressions should you do? Ay, by the way, sino sa inyo nag-CPR training na? Wala pa kayo?
Hindi ko pa.
Wala bang actual, but I
merong
did
na heart
dati, Red Cross.
Okay.
Red Cross.
Dapat kung aralin yan, meron na heart attack na hindi ko na save.
Okay.
Hindi ako marunong.
So how many chest compressions should you do?
30 per minute.
100 per minute.
Yeah. Manood na lang tayo sa YouTube, ha? Marami niyan, CPR. You stop giving CPR when the casualty starts breathing normally again, when you become too exhausted to continue, or when
The emergency personnel
The
take
personal takeover.
unless absolutely necessary, you shouldn't
move a casualty.
Move the
Move a casualty.
in order to keep an
Move.
injured person calm, it is important to
Tell them what you're doing.
Tell them
kasi
what you're
mapapanik
doing.
yan. Pag hindi mo sinasabi. What do you do if a casualty is breathing but not responding?
Place them in the recovery
position.
As well as checking whether the casualty is conscious and breathing, you should also check
The
Signs
family
for signs
contact.
of blood circulation.
mamaya na yung family. For signs of blood, baka mamaya marites pa kayo. For signs of blood circulation. That's at least that's safe. If while driving, okay, let's go now. Yeah. If while driving, you are the first person to arrive at a traffic accident, you will need to park your vehicle safely away from the accident, and you will need to
Switch on the
It's on your hazard lights.
when dealing with a traffic incident on a motorway, you should
never run across a busy lane.
yes. One of the things you can do to secure the area of a traffic incident is to
Switch
Switch
off
off.
the ignition of damaged vehicles.
yes. Pero do you think you can still do
Switch off.
it? Pagpapanik ka na, di ba? Sige, practice na. In a traffic accident, you should always assume that the casualty may have suffered
A neck or
spinal injury.
One way to cut off the oxygen supply of a fire is to
Close a door.
close the door.
kasi kung i-ventilate mo yung room, lalong dadami. Kaya nasusunog. When leaving a building on fire, you should... Ay naku, this is very relevant ha. Ang dami pa namang sunog ngayon. When leaving a building on fire, you should...
Never use
Never use lips.
Okay. What is the procedure when someone's clothes are on fire?
Stop, drop, and roll.
Drop roll.
Wow. You should lay down a burn casualty with
burnt side.
Burn side
uppermost. You should never enter a building that is
On
On
fire.
fire.
on fire.
If you are trapped in a burning building, you should go to a room
With a window.
Window.
Natatakot yung
With a
mga
window.
mga boarding house walang window. Kaya alat. Once in a room with a window, you will need to close the door and
Black smoke
Black
from
smoke from
Black
coming in.
smoke from coming in.
escape through a window from a burning building. It is important to go out. Paano?
Very quickly.
feet first.
Feet
Feet
first.
first.
Unless kung meron
Baka
kang
mainit,
plano.
baka mainit to. Kaya
Paa
baka
mo.
yung mauna.
Yes, paa. Once you have put your feet out of the window and before you drop down, you have to
Lower
Lower yourself
to your
to your full
length.
length.
What would prevent a person from breaking contact in an electrical accident?
Muscle spasm.
When dealing with electricity, which incident would usually be immediately fatal?
lightning
Contact
strike.
with high voltage current.
Contact with high voltage current. Kasi minsan naman yung lighting din naman. Next, before approaching a casualty struck by high voltage, you need to make sure that
The power is cut
The
off.
yes. How far can an
Oo, baka
electric
madami.
spark from a high voltage source reach?
6
18
meters.
18 meters. A casualty who is, matatandaan pa kaya natin. A casualty who is still in contact with an electrical current is considered live and
Live
Not
and
Should not be
not
touched.
be
to break the contact between a casualty and an electrical current, you should stand on a dry, insulating material and
They
use a
use
wood.
wooden
Use a
object.
wooden object.
which of the following is an insulating material on which you can stand?
Plastic mat.
Plastic mat. If you cannot break the contact with a wooden object, you can.
Pull the
Pull
victim
the
away with
victim
a
away
cord.
with a cord.
If you pull the victim away from electrical current, you must make sure that you
Do not touch them
Do
not
not
directly.
touch
touch
them
them
directly.
directly.
okay. When carrying an unconscious drowning casualty out of the water, make sure that you keep their head paano?
Lower
Higher
Lower
than
than
their
their
chest.
chest.
higher,
Wow.
Lower
higher.
than the chest.
Yung
Lower,
head mas mataas at chest.
lower. Mas mataas ba?
Lower.
Lower than the chest. A
Lower
sudden entry
than?
into very cold
Yeah,
water
lower.
can increase blood pressure. Let's say nag-snow bigla dyan sa Manila, no? Nagkaroon tayo ng mga East can cause.
Heart.
Heart attack. Heart
Kaya
attack.
pag masyadong biglang malamig,
Frostbite?
you should never have cold shower kaagad. Mainit-init muna.
Mm.
If a person has been in cold water for a long period of time, they might be suffering from.
Hypothermia.
Hypothermia.
The safest way to pull someone out of the water without endangering your life is to.
Stay on land.
Stay on land.
Once a casualty is out of the water, you need to stop them getting cold by.
Shielding them from the wind.
You may tackle a small fire by using.
A fire blanket.
Fire blanket.
In a traffic accident involving trucks, ang dami ngayong aksidente, no? It is important to.
Switch off the fuel
Switch
supply.
off the fuel supply.
So, okay, una kaagad hanapin mo yung ano. When dealing with a traffic accident, you need to do a thorough search of the area to look for people who may have.
Been thrown out of
Out
windows.
of vehicles.
From the
Now, let's talk about mass casualty incidents. Pero masyado mang-morbid yung mass casual.
reality naman yan, Doc.
Oo nga, it can happen. Oh my God, wag naman sana. When dealing with the
Mas
mass casualty,
common.
well, it can happen, no? You can always open your
Yes.
laptop, your cell phone. Lagay na kaagad sa utak ka. When dealing with the mass casualty incident, you must apply what is known as the 5 S's. The first S is for
Safety.
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 The reason why you must
Safety.
assess safety first and not rush into help is because
You must become a casualty yourself.
yes,
You mustn't become a
Yeah.
casualty yourself.
the second S,
Sizing up the scene.
when you size up the scene, you have to
Sending
take
for
a
help.
picture to determine what kind of emergency you're dealing with, how many casualties there are, and if there are.
Access
Access
points
point for
for
Access
emergency
points
services.
for emergency services.
The third S is for
sending help.
Sending for help.
Sending for help.
Sending for help.
when calling the emergency services, make sure to tell them what type of emergency it is, an approximate number of casualties where the event has taken place, and
Type of help.
type of help.
Type of help needed.
Okay, the fourth S,
Set up.
set up.
Set up.
You will want a safe place away from the worst injured area for the
Paramedics.
Paramedics.
Walking
wounded.
Oh.
You will want a safe place away from the worst injured area for the walking wounded. May lumalakad pa.
Okay.
The last S stands for
Okay.
START. What does the acronym mean?
Simple triage
triage,
and
rapid.
rapid.
treatment.
Roughly, how long should you spend with each casualty for your primary triage?
30.
30
30
seconds.
seconds.
30
30
seconds.
seconds.
The goal of the primary triage is to quickly evaluate
Respiration, blood
Respiration.
circulation, and mental
Circulation and
status.
status.
Primary triage is also used to quickly determine
Who needs help
Who
most?
needs help most urgently?
priority mo yun. A general color coding system can be used to triage casualties at an MCI. Though there are no hard rules, the most commonly used colors are
Red,
Red, yellow,
yellow, green,
black.
black.
in a triage situation, the color red is used for victims who
Need
Immediate
Immediate
attention.
or
attention.
bleeding.
what color is used for the walking wounded?
Green,
Green.
In an MCI situation, a yellow
yellow.
used for victims who
Need
Need
care.
care
within
for 2
2
to
to
4
4
hours.
yes, need care within 2 to 4 hours. So medyo may pag-asa pa. A yellow label means the victim is not in need of immediate care but has injuries which
Could
Would
become
be
life-threatening.
a black label or
Black
tag is for the casualties.
Who are
Who
deceased.
are deceased.
Casualties who are not expected to
Ay, na.
survive because of the severity of their wounds are given
Black.
Black label.
When checking for respiration, you will give the casualty a red tag if they take
More than 30,
more than
30 breaths a minute.
more than 30. If a person is breathing after you've opened their airways, which tag should they be given?
red tag.
It's a
Checking
red.
blood circulation, perfusion is done by checking the pulse on the wrist or the neck or by
Pressing on the nail bed.
nail bed.
what does CRT stand for when related to checking for blood flow and circulation?
Ciliary
Circulatory
refill
refill time.
Capillary refill time. When circulation is normal, how long should it take for the nail bed to return to pink after having been pressed?
2 seconds.
2 seconds.
Sige, tinando natin sino dyan 2 minutes. If the nail bed takes longer than 2 seconds to return to pink, the casualty is given
It's
a
red.
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 Red tag.
When checking for mental status, you are looking to see if a casualty can
Respond.
Respond.
to
Simple commands.
Okay. What color of tag should the casualty be given if their respiration is fine, their blood circulation is normal, but they are showing symptoms of disorientation or are unconscious?
Green.
Red tag.
Red tag.
If in doubt
Red.
regarding the condition of any casualty, ano ilalagay mo if in doubt?
Give a
Give
red
a red.
tag.
What should you do if you suspect the casualty is suffering from shock?
Give a
Give a higher
higher.
Tag.
In an MCI situation, what type of first aid treatment do you most urgently need to give?
Stop bleeding.
And restore
Breathing and
breathing.
restore breathing.
Now let's go to
Restore.
respiratory first aid. Low blood oxygen is called
Hypoxia.
casualty suffering from mild hypoxia will have
Difficulty
Difficult.
thinking clearly.
how long without oxygen does it take for brain cells to start dying?
3 minutes.
3
6
minutes.
minutes.
Signs of hypoxia are a gray-blue tint to the lips, noisy breathing, red puffy face, and
A persistent
Restraint.
dry cough.
hanging casualties should be handled carefully because they might hanging, yung nagpakamatay, nagbitay.
Broken neck.
Broken neck.
A drowning casualty who has recovered quickly should still go to a hospital because the water may have irritated the lungs and the air passages could.
Become swollen.
Hours later.
When the air passages swell hours after a drowning incident, this is called
Secondary.
Secondary drowning.
the symptoms of a prolonged exposure to low levels of carbon monoxide are headaches, confusion, nausea, and
Lethargy.
Aggression.
aggression. Along the
Oh.
collapse, if air enters,
Uh,
The pleural
Pleural
space.
pleural
space.
space. A collapsed lung is called
Pneumothorax.
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 a pneumothorax could be caused by,
Chest wound.
Chest wound.
and also if you need the lung one very, very deeply. When dealing with a
Lung one.
penetrative wound to the chest, you need to
Cover the wound
Cover
and
Cover the
maintain
wound and
breathing.
maintain breathing.
acute anxiety and panic attacks can cause
hyperventilation.
Hyperventilation.
someone suffering an
Ay-
asthma attack will have difficulty and will have a
Long
Short
breathing
Long
out.
breathing
breathing
out.
what color is the cap of the inhalers? Sino ba dito asthmatic? Used to relieve an asthma attack.
Ako, Doc.
Ah.
Blue cup.
Blue cup
Blue-
yata.
Ay,
Blue
wow.
cap.
Nakarelate
Ako, blue cup.
talaga. Blue cap. Sino yun?
Yes,
Blue
I
cap.
have one.
Ah, okay.
Mm.
Congrats. Okay.
Wait natin yan.
A treated mild asthma attack should ease within
3
3
3
minutes.
minutes.
It's 3 minutes.
Okay. Croup is caused by an inflammation of the
Nose
windpipe
and
and
Windpipe and
larynx.
larynx.
windpipe and larynx.
an obstruction of the airways can be caused by a foreign object or by
Internal swelling.
casualty of strangulation or hanging will have
Prominent veins
Prominent
on
veins on the face.
yes. Sige, subukan mo. Sino naka okay, wag na lang.
Ay, wag na.
Sabi na natin kung lalabas. If dealing with strangulation or hanging, it is important to keep the material that was constricting the neck as
The doctor will want
The
it.
police will want it.
police. Police important. When dealing with a casualty
Or-
of drowning, it is important to restore breathing and
Keep the
Ah,
cavity
Keep them
warm.
on them.
warm.
carbon monoxide is a gas that stops red blood cells from
Carrying
Carrying
oxygen
oxygen
to
to the bloody tissues.
some of the effects of smoke inhalation are coughing and wheezing, rapid and noisy breathing, and
Burning
Burning
in
of
the
the
mouth.
mouth nose.
frothy red blood being coughed up may be a sign of
Smoke.
Penetrating
Wound
to
in
the
the
lungs.
lungs.
during a severe asthma attack, the person, sino yung asthmatic dyan?
Ako po.
The person may, what's your answer here?
Become
Become
exhausted.
exhausted.
Become exhausted.
The group is an attack of severe breathing difficulty that affects.
Very young children.
Very young children.
In order to stop a group attack from recurring after one that has just happened, you need to
Create a
Create
humid
a humid atmosphere.
Humid atmosphere.
epiglottitis is when the epiglottis is infected and can.
Block the
Block
airways.
the airways completely.
During an asthma attack, you will need to call the emergency services if the casualty worsens, or if the relief inhaler, if one is available, has had no effect after
5 minutes.
5 minutes.
5 minutes.
Before entering a garage full of exhaust fumes, you must.
Let the gas escape.
Thank God.
Yes. Hanapin mo. Now let's go to general physiology. Which of these vessels carries oxygenated blood from the heart?
The
Pulmonary artery.
Where does the right ventricle in the heart pump blood to?
The lungs.
The lungs.
Which of the following is not transported in plasma?
Bile.
Bile.
Name the contractions that push blood through the esophagus.
Peristalsis.
Peristalsis.
Okay. What type of acid is found in the stomach?
Hydrochloric acid.
Hydrochloric acid.
Where is bile made?
The liver.
Blah, blah.
What
Liver.
are steroid hormones made of?
Lipids.
What kind of hormone is estrogen?
Steroid.
Steroid hormone.
What type of cell provides the barrier of the skin?
Keratinocyte.
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 What is the basic functional role of the cerebellum?
Motor
Motor
activity.
activity.
Where does fertilization occur?
In the
Oviduct.
uterus.
Okay, another name is the fallopian tube. No? How many
Oviduct.
chromosomes are in a haploid cell?
23.
23.
Sex cells are examples of what type of cell?
Haploid.
Haploid cell.
When does ovulation occur?
After
Follicular.
follicular phase.
Wow, alam na mga lahat. Contraction of the diaphragm causes which action to take place?
Inspiration.
Inspiration.
Inspiration. Which compound in the blood carries oxygen around the body?
Hemoglobin.
Hemoglobin.
The scalene muscles are accessory muscles to which action?
Inspiration.
Inspiration.
What type of condition is asthma?
Obstructive condition.
Antidiuretic hormone or ADH is produced by
Pituitary.
Gland.
which blood vessels supply the kidneys with blood?
The
Renal
renal
arteries.
Renal arteries.
What kind of signal does a cardiac pacemaker use?
Electrical.
electrical.
What is a thrombus or review na lang?
A blood clot.
Blood clot.
Which of these is accessory organ to digestion?
Gallbladder.
The wall of the intestinal villi is approximately blank thick.
1.0 cell.
Wow.
One cell.
What is a bolus?
A ball of mashed
Bolus is a ball of
Masticated food.
masticated food.
Which of these is not indicator of an overactive thyroid?
Weight
weight
gain.
gain.
Weight gain.
What substance is used to make steroid hormones?
Cholesterol.
Cholesterol.
Sebum secreted from the...
Beef.
Sebaceous gland.
What is alopecia?
Hair loss.
Hair loss.
Hair loss.
What are immune cells in epidermis called?
Langer.
Langerhans.
Which organ produces hair?
Hair fall.
Hair follicle.
Which of the following
Hair
does not
follicle.
protect the brain from damage?
Immunoglobulins.
What is the name of the electrical signal in a neuron?
Action potential.
What fluid surrounds the brain to protect it?
Cerebrospinal.
Spinal fluid.
How many chromosomes does a child receive from its father?
23.
23.
What is the production of male sex cells called?
Spermatogenesis.
What causes hiccups?
Spasms.
Spasm.
Spasms in the diaphragm.
The Bowman's capsule drains into which part of the nephron?
Loop of Henle.
Loop of Henle.
Where in the kidney does reabsorption of water take place or occur?
Loop of Henle.
Loop of Henle. Filtered blood leaves the kidney via which vessel?
Renal.
Renal vein.
Which component of blood is crucial to clotting?
Platelets.
What shape are red blood cells?
Biconcave.
Biconcave.
What is the result of improper blood flow in a coronary artery?
Heart attack.
The glands that produce amylase are in
Mouth.
Mouth.
which part of the body performs mastication?
The
Mouth.
mouth.
The stomach is rich in folds called.
Rugate.
Okay.
Where does the descending colon lead to?
Rectum.
Which of these hormones is released in response to stress?
Cortisol.
So wag na mas. Which of these increases the metabolic rate?
Thyroxine.
Thyroxine.
What kind of hormone crosses the target cell membrane?
Steroid hormone.
Which one of these is a sex hormone?
Estrogen.
UVB, ultraviolet B radiation damage can cause which of the following?
Malignant melanoma.
Sunburn.
Which of these is an excitatory neurotransmitter in skeletal muscle?
Dopamine.
Acetylcholine.
Acetyl.
What supplies the fetus with oxygen and blood?
Umbilical
Umbilical.
How many chromosomes does a zygote contain?
46.
46.
Okay. Which
46.
process is used to produce sex cells?
Meiosis.
Meiosis.
Which of these are
Mitosis.
accessory muscles to inspiration?
Diaphragm.
Sternocleidomastoids.
What does the pressure in the lungs do during expiration? Exhalation
It increases.
increases. What causes an
Increases.
oxygen death in the body?
Anaerobic.
Anaerobic.
Exercise.
During periods of hydration, urine will be blank.
More
dilute.
Now let's go to cell physiology. The plasma membrane provides the outer boundary of
The cell.
The cell.
the cell membrane is made mostly from a double layer of
Phospholipids.
the cytoplasm of
Phospholipids.
the cell is blank water. How many percent?
80%.
Cytoplasm includes organelles and
cytosol.
Cytosol.
what separates the nucleus from the cytoplasm of the cell?
Nuclear
Nuclear
envelope.
envelope.
Which of the following is found inside the nucleus?
Nucleolus.
Nucleolus.
Which organelle digests other worn out organelles as well as food particles and engulfed viruses and bacteria?
Lysosome.
The lysosomes.
Where are the cell's chromosomes stored?
Nucleus.
Nucleus.
Which organelle is particularly important for the synthesis, folding, modification, and transport of proteins within the cell?
Endoplasmic reticulum.
Which of the following has ribosomes or ribosomes attached to its surface?
Rough
Plastic
endoplasmic
reticulum.
reticulum.
After transporting and modifying proteins and lipids, the Golgi apparatus packages them into
Vesicles.
which organelle acts as an assembly line where proteins are synthesized from RNA?
Ribosomes.
Which organelle generates energy for the cell?
Mitochondria.
Mitochondria.
Which of the following organelles could be described as a compartment filled with water containing inorganic and organic molecules?
Vacuole.
Vacuole.
Network of interlinking filaments and tubules providing a cell with shape and stability.
Cytoskeleton.
Cytoskeleton.
Carbon dioxide and oxygen move across the plasma membrane by the process of
Diffusion.
Fusion.
what is the name for the process whereby the membrane of a vesicle fuses with the plasma membrane, allowing its contents to be released from the cell?
Endocytosis.
Endocytosis.
Exocytosis.
The outer layer of the cytoplasm is called
The ectoplasm.
Ectoplasm.
the
Exo.
microtubule
Plasma.
organizing center of the cell is
The
Centrosome.
centrosome.
centrosome is composed of how many centrioles?
2.
2.
Genetic information is carried out of the nucleus and to the sites of protein synthesis in the cytoplasm by
DNA.
mRNA.
okay, lahat kayo
mRNA.
meron yan, di ba? What do you mean by M? Don't tell me you forgot. Lahat tayo may subject niyan. Naku, wala na. Messenger RNA. Siguro you must hate your teacher so much, no? Okay. The site of ribosome synthesis and assembly within the cell is
The nucleolus.
Nucleolus.
DNA replication takes place in
Nucleolus.
lysosomes are
Nucleus.
known to contain more than 60 different enzymes. Where are they synthesized?
In the rough plasmic reticulum.
Which of the following is associated with production and metabolism of fats and steroid hormones within the cell?
Smooth
Smooth
plasmic
Plasmic
reticulum.
reticulum.
Processing and packaging macromolecules such as proteins and lipids is the primary function of which of the following?
Golgi.
Golgi apparatus.
Which of the following is involved in production and folding of proteins?
Rough endoplasm.
The rough endoplasmic reticulum.
Ribosomes link amino acids together to form polypeptide chains according to instructions from?
mRNA.
mRNA.
What does the M mean?
Messenger.
Okay, the energy generated by the mitochondria is carried to where it's required beneath the cell by molecules of?
ATP.
ATP.
Which type of organelle is used within the cell to ingest extracellular fluid and molecules?
Pinocytotic.
Cytosis.
Thank you so much for joining. Any questions? Are you still having energy?
Alive.
Thank you so much. Congratulations, everyone.